it is a unresolved issue. The hub connector disinfection using the caps is moderate nowadays, and the infusion vascular access team is important to consider, and sutureless securement is still a unresolved issue. The strategy are two parts. One part related to the insertion, and the other part related to the maintenance. The insertion, as you know, providing the knowledge of risk factor, safest insertion site, like using subclavian vein or the BIC line, for example, positioning of the patient, trainee experience, hand hygiene, antisepsis, maximal sterile barriers, number of needle sticks, line, antibiotic impregnated catheters. Related to the maintenance, tubing replaced after blood product, hub replaced after any opening, nurse-patient ratio, specialized team, protocol for removal, dressing, hand hygiene, all are important in the maintenance. And this is related to the hand hygiene. It's very simple, but very important measure to prevent the MDROs and the eclampsia. Please remember the environment around you. We are usually focusing on the patient, but please remember the environment around the patient. We have to make sure that we are doing proper disinfection and the cleaning of the equipment and the items near the patient to prevent to decrease the cross transmission. And this is the environment, and terminal cleaning and daily cleaning is very important to prevent the infection. You can see here the colonization of the healthcare worker will increase the risk of infection for the patient, for MRSA and VRE based on these studies. Catheter insertion card kit is important for the insertion, part of the insertion. Organizing the central line insertion bedside tray prior to this is very important. And also please avoid using the femoral line as I mentioned in adult and as well as in pediatric. And subclavian vein in hemodialysis and patient with advanced kidney disease, and better to be avoided to avoid the subclavian vein stenosis. This is showing the difference between the line area, and you can see here from infectious point of view, the complication with the subclavian is less compared to the femoral line insertion.
Dr. Abdurrahman.
And you can see here the big line.
5 minutes.
You can see the big line is less with less infection compared from patient point of view, no significant difference. You can see here the internal jugular line is compared to femoral line, and big line is less with the internal jugular line. Ultrasound is recommended nowadays, but as I mentioned, it should be with the steel technique, and it's easy to localize the vein by using the ultrasound. And you can using the ultrasound compared to the landmark group by using the other technique. The number of the success is better, the puncture is less, and the CVC bloodstream infection is less with the ultrasound group to the land group. You can see 47 compared to 72. You can see here also with the ultrasound also the success rate is much better. Another study showing the number of attempts is less, and the complication rate is less comparing the ultrasound with the landmark group. Skin preparation is very important. Using the chlorhexidine is strongly recommended nowadays. And the catheter side dressing, chlorhexidine integrated dressing is currently recommended. And most of the studies show the rate is decreased, but it is not recommended for the neonate. Also, this is another study showing the chlorhexidine dressing beneficial to prevent the complication, and also another studies also showing the after, pre, and post chlorhexidine bathing. Also, another important preventive measures you can see here. Before bathing and after bathing, the rate is decreased. So the evidence, bathing is important for eradication, mainly the gram-positive skin commensal. Maximal barrier precautions is very important, actually, and it's recommended for the insertion of the lines to avoid the contaminated procedures during the insertion of the line. Systemic, what about systemic antibiotic prophylaxis? The prophylaxis prior to CV is not recommended. Prophylaxis with intravenous vancomycin